And now I'd like to introduce John Shadegg, the leader on insurance reform from Arizona.
Thank you very much, Mark. You know, Paul, you may feel old. Trust me, you don't look old. I just want to start by pointing out what this is really all about. The president said, and I'm glad he said it, he said point blank, I welcome, if you come to me with a serious set of proposals, I will be there to listen. That's a great offer. Unfortunately, it has not been true to this point in time. I've worked on health care reform since I got here in 1995. I think I have written more health care reform proposals than any member of Congress. I began writing patients' bills of rights back then. I wrote some with Charlie Norwood. I wrote some with Tom Coburn. I wrote one at the request of Denny Hastert. I have written a bill which addresses the #1 concern the White House is using right now to sell its proposal. The President said in his address the other night to the joint session of Congress that the proof that we need health care reform, and he says it's proof that we need a government-run plan, is that in many states, as much as 75% of the people in that state who buy a health insurance policy in the individual market have only 5 plans to choose from. And he pointed out in his address that in at least one state, 95% of the people have only 5 plans or get their plan from only 5 companies. Well, welcome to the discussion, Mr. President, because I offered a bill 3 years ago to address this issue. It's a bill called the Improving Health Care for All Americans Act. It would allow you to buy health care, a health care plan offered in one state, which was then brought to and offered for sale in all 49 other states. That bill, you just heard about New Jersey, that bill came out of New Jersey. It came out of the fact that people in New Jersey had learned that the cost of health care in New Jersey was 5 times as high as the cost of a health care plan in neighboring Pennsylvania. And you know what? They discovered they were going to the same doctors and the same hospitals and paying 5 times as much. You know what people were doing? They were shopping with their feet. They were essentially committing insurance fraud. They'd go to their brother-in-law or their cousin who lived across the line in Pennsylvania and who discovered that their policy in Pennsylvania for the same family of 4 people was 1/5 of as expensive. They'd say, well, let me apply from, because I go to the same hospitals, the same doctors, let me apply from your address. I'll get the same coverage. I'll go to the same doctors and the same hospitals, and I'll pay 1/5 as much. Mr. President, the idea of increasing competition for individual insurance policy is out there. It's been out there for at least 3 years in the bill I wrote. But unfortunately, I was not invited to the White House to discuss that. Neither was anyone else invited to the White House to discuss that issue. The ranking member on health care of the Commerce Committee with primary jurisdiction, not invited to participate in the drafting of any bill on the House side. The ranking member of the full committee of the Commerce Committee, not invited to participate in any discussion. So I have an interstate commerce bill that would bring down the cost of health care in the individual market. I also have a bill, which Mike Pence mentioned, called the Improving Health Care for All Americans Act. It has different ideas. It has ideas that I would argue are a serious set of proposals. But the President hasn't been interested in those ideas so far. So let's talk about where there's agreement and what we could be doing. Every single Republican bill up here, every single one. Paul Ryan's bill with Tom Coburn and Senator Burr in the Senate. Each of the other doctors' bills up here, every Republican bill addresses 2 of the most critical issues. We all address pre-existing conditions. None of us allege they should be allowed to continue to deny people care. All of us propose to solve that problem. As Paul Ryan pointed out, every Republican proposal embraces universal coverage, covering every American. We all do it. If there's no agreement on those 2 issues, Mr. President, why don't we fix them? Now, where there is disagreement, Paul Ryan laid it out pretty clearly. The President says the answer to controlling costs is to get the government vastly more involved. We don't agree with that. We believe getting people involved, like everywhere else in our economy, will solve the problem. You put patients first, and you will drive costs down and quality up. Now, we have different avenues for doing that. I believe that if you have an employer-provided plan and you like it, you should be able to keep it. But you should also have the option of not taking it and buying your own plan. But the other side won't discuss those options. It's time for us to have a positive bipartisan discussion. My bill, Improving Health Care for All Americans Act, lays out exactly how we can bring down the cost of health care in America by letting people get more involved. It's interesting. My colleagues on the other side of the aisle say wellness is critical. But if somebody else is paying the tab for your health care, you're not motivated to care about your wellness. Republicans say we need to get people engaged in their own health care. But we can't do that if the world doesn't know we have alternatives and that they're out there and they ought to be thought about and read. And if the press tells them there are no Republican alternatives, and we can't have that discussion if the president only uses rhetoric to refer or to claim that there are no Republican plans when in fact there are many Republican alternatives. We're just focused on patient choice.